Hi, everyone. My name is Dr. Jeffrey Gemi, Director of the Anterior Segment at AURA. And it's my pleasure today to bring to you my findings for my poster presentation for this year's ARVO conference. The title of my poster is Comparing Schirmer's Test with Other Clinical Outcomes. The idea behind this poster is to identify how Schirmer's test correlates with other tests in dry eye. In the realm of dry eye, we have a variety of clinical diagnostic tools to determine not only the presence of dry eye, but also the severity of disease. Schirmer's test has long been a hallmark diagnostic technique used by clinicians to determine the presence of dry eye in patients. With that being said, how well does Schirmer's test identify dry eye, and how well does Schirmer's test analyze for severity of disease in these patients when compared to other clinical outcomes? In other words, can we reliably capture dry eye using Schirmer's test and be confident that other clinical diagnostic techniques will yield the same information? In this particular poster presentation, we looked at over 1,000 patients, approximately 1,149 to be exact. And we looked at total corneal staining. We looked at regional staining. We also looked at burden of disease among patients who have dry eye and the duration of disease, and we compared that to their Schirmer scores. And what we found is that patients who have worse Schirmer scores, meaning typically less than 5 millimeters on Schirmer's test, who have a severe disease burden, also have increased corneal staining, typically are older, and typically share a longer duration of burden of disease. So what this tells us is that Schirmer's score can accurately capture dry eye disease intensity as it relates to other clinical outcomes. We can use Schirmer's score reliably to predict how patients will ultimately stain and also predict the longevity of disease among patients. And so this is the premise of this particular study. And we're very pleased with the results, and I'm happy to be presenting this information at this year's ARVO conference.